Hello, my name is Lawrence Holve, and this is a quick talk on headaches. Theme today will be on what are called cervicogenic headaches. So, first of all, a quick, not warning, but to be alert to, cervicogenic headaches are those headaches really emanating from the back of the neck, coming over to the vertex or around to the eyes. So, first of all, to differentiate from headaches caused by more sinister things, for example, things like meningitis, where you get a rash and they're thumping headaches. These are not cervicogenic headaches, and that needs immediate hospital attention. Or those headaches which you may get, which you think are just a normal headaches, but they just get worse over weeks, unremitting. You might even get visual disturbances. Those should also be checked just to make sure there's nothing growing inside your head. Um, but those, thankfully, are quite rare. So, what I'm talking specifically about these headaches emanating from the neck. So, what are the structures? Well, your neck has got a lot of joints in it, so it's surrounded by muscles, tendons, nerves. And these can all be sensitized, particularly in those people with things like restrictions. So, very often, cervicogenic headaches, people will talk of neck restrictions. They'll be able to only move their neck a little bit. And they say when they move their head, they start getting a pain. That almost tells you that that is what they're suffering from. So um, the other type, or the other condition that you get with it, people often complain that the neck is tight but also very sore. So particularly in those people with osteoarthritis or degenerative changes in the neck, disc thinning, which you tend to get when you're a bit older, these sort of headaches are much more common. Now, people say, well, I've got these headaches. What can you do about them? Well, there's quite a lot you can do because the normal mainstay is that people, when they have these headaches, take things like paracetamol, naproxen. Naproxen, being an anti-inflammatory, certainly helps, can help ease the inflammation caused by these joints, but of course it's temporary. The moment you stop the naproxen, pain comes back. Same with paracetamol; it really just dulls the pain. So really, there's a couple of choices. The more conservative treatment, you can certainly use physical treatment like osteopathy and soft tissue manipulation around these joints because that helps reduce muscle spasm. If you reduce muscle spasm, less pressure or irritation around the nerves, what are called the suboccipital nerves that come up over the head to the eyes, and that can bring relief even just after treatment. The other treatment that I find very helpful in treating these types of headaches is acupuncture and trigger point treatment. So, with treatment of this kind, you're using points, acupuncture points at the back of the head, just below the occiput or the base of the skull, and often in the trapezius. That's these thick muscles on the side. By using acupuncture, you can get a quick release, and I've had many patients, for example, who come with a headache. You can relieve it there and then. It's that quick. Um, and the other advantage is that the treatment tends to be long lasting. So, very often, if I have a patient suffering from these sort of headaches, a few treatments, not even that many, 3 to 5 sessions, usually gives them weeks, months, and sometimes I don't see a person again because after treatment, they can move their neck again. And if they keep that up, very often they don't need much after treatment. So, you have a good success rate. If conservative treatment doesn't help, then especially if a neck is so stiff that you can't get anywhere, then sometimes if you go to a orthopedic physician or surgeon, they're looking more at using nerve blocks to put in the back of the head. But again, I get many patients who've had this sort of treatment come back, and usually, again, things like acupuncture can help maintain any improvement that they get from that. And treatment in those cases can be sometimes short term as well. So, if you have suffer from these headaches, or if you want any information, let me know, and I'm very happy to discuss it with you. But you'll find that physical treatment, osteopathy, acupuncture, to me, are the main forms of treatment to help alleviate these kinds of headaches. I hope this has been helpful for you. Let me know in comments, and hope to hear from you. Thanks very much for listening.